Medicaid, the nation's largest healthcare program, is at a crossroads. Rumors have swirled about its potential demise in 2025. Let's be clear, Medicaid is not ending. However, it faces significant proposed changes from House Republicans. These changes are part of a broader bill encompassing tax cuts, military spending increases, and a reshaping of the social safety net. This essay will delve into the proposed changes to Medicaid, explaining the motivations behind them and their potential impact on individuals and states. We'll explore the key proposals, including work requirements and cost sharing, and examine the political dynamics surrounding these changes. Our goal is to provide a clear, concise, and accessible explanation of this complex issue, free from technical jargon. Understanding the nuances of these proposed changes is crucial for every American. Medicaid provides a vital lifeline for millions, offering access to essential healthcare services. The outcome of this debate will have profound consequences for the health and well-being of countless individuals and families across the nation. The Republican-led House of Representatives is pushing for substantial savings in federal spending, and Medicaid has become a prime target. Their proposed changes to the program aim to achieve $880 billion in savings over the next decade. This drive for fiscal austerity stems from a confluence of factors. Republicans argue that reining in government spending is essential for long-term economic stability. They contend that the current trajectory of entitlement programs like Medicaid is unsustainable and will ultimately lead to higher taxes or a fiscal crisis. Additionally, they believe that reforms are necessary to promote personal responsibility and reduce reliance on government assistance. These proposed changes, however, face significant opposition from Democrats and healthcare advocates. They argue that the cuts would harm vulnerable populations, including low-income families, people with disabilities, and the elderly. They contend that the proposed savings come at the expense of those who can least afford it, and could lead to increased healthcare costs in the long run. The debate over Medicaid's future reflects a broader philosophical divide in American politics regarding the role of government in providing a social safety net. This fundamental disagreement will continue to shape the debate as lawmakers grapple with the challenge of balancing fiscal responsibility with the needs of vulnerable citizens. The GOP's proposed changes to Medicaid would have far-reaching consequences for states, potentially creating a fiscal crisis for many. The plan seeks to shift significant financial responsibility from the federal government to individual states. While proponents argue this allows for greater flexibility and innovation at the state level, critics warn of dire consequences. One of the most significant impacts would be a reduction in federal funding for Medicaid. This would force states to make difficult choices, such as raising taxes, cutting benefits, or reducing eligibility for the program. Some states, particularly those that have expanded Medicaid under the Affordable Care Act, could face particularly severe funding shortfalls. The GOP plan also aims to curb states' ability to levy provider taxes, a crucial funding mechanism for their share of Medicaid costs. This move could have a disproportionate impact on states like New Jersey, which relies heavily on provider taxes to fund its Medicaid program. The uncertainty surrounding future federal funding levels would create budgetary chaos for states, making it difficult to plan for the long-term needs of their Medicaid populations. This uncertainty could also lead to a patchwork system of Medicaid benefits and eligibility across the country, further exacerbating existing healthcare disparities. At the heart of the GOP's proposed Medicaid changes are two key provisions: work requirements and cost sharing. These measures represent a significant departure from the program's traditional structure and aim to fundamentally reshape how Medicaid operates. Work requirements would mandate that able-bodied adults without dependents work or engage in community service for at least 80 hours per month to maintain their Medicaid coverage. Proponents argue that this provision promotes personal responsibility and encourages individuals to transition to employer-sponsored health insurance. Opponents counter that it creates unnecessary barriers to health care for low-income individuals who may face challenges finding and maintaining employment. Cost sharing would require Medicaid beneficiaries to contribute a portion of their income towards their health care costs, capped at 5% of their income. While proponents argue that cost sharing can help control healthcare utilization and costs, opponents express concerns that it could make healthcare unaffordable for low-income individuals and families, leading them to forego necessary care. The implementation of work requirements and cost sharing would represent a fundamental shift in Medicaid's mission, potentially transforming it from a safety net program into one that more closely resembles private insurance. The long-term consequences of these changes on healthcare access, affordability, and health outcomes remain uncertain. Section 5, Medicaid Expansion, a program caught in the crossfire. Medicaid expansion, a key provision of the Affordable Care Act, has extended coverage to millions of low-income adults. As of May 2025, 41 states and Washington, D.C. have adopted expansion, leaving 10 states yet to do so. The GOP's proposed changes to Medicaid have raised questions about the future of expansion and its impact on states that have embraced this policy. While the proposed changes do not explicitly repeal Medicaid expansion, they could undermine it in several ways. The reduction in federal funding for Medicaid could make it more difficult for states to maintain their expansion populations. Additionally, the introduction of work requirements and cost sharing could create barriers to enrollment and lead to coverage losses among those who gained coverage through expansion. The uncertainty surrounding Medicaid's future has created anxiety among states considering expansion. Some states may be hesitant to implement a program that could face significant cuts or changes in the near future. This uncertainty could have a chilling effect on expansion efforts, leaving millions without access to affordable health care. The debate over Medicaid expansion highlights the ongoing political battle over the Affordable Care Act. Despite surviving numerous repeal attempts, the ACA remains a divisive issue, with Republicans continuing to seek ways to scale back its reach and impact. As the debate over Medicaid intensifies, political battle lines are being drawn. Lawmakers on both sides of the aisle are preparing for a showdown that could shape the future of healthcare in America. The stakes are high, and the rhetoric is heating up. The proposed changes to Medicaid could have far-reaching consequences for millions of Americans. Vulnerable populations including children, the elderly, and those with disabilities stand to be the most affected. Access to essential healthcare services could be severely limited, leading to a potential public health crisis. Beyond Medicaid, the bill includes several other healthcare provisions that could impact coverage and costs. Proposals to change insurance regulations, alter funding mechanisms, and adjust eligibility criteria are all on the table. These changes could reshape the healthcare landscape in ways that are still being debated. So, what's next for Medicaid and the broader healthcare system? The legislative process is far from over, and the outcome remains uncertain. Stakeholders from all sectors are weighing in, and public opinion will likely play a crucial role. As the situation evolves, staying informed and engaged will be more important than ever.